Hi, everyone. My name is Tamara Taggart, and I am here to welcome you. I'm joining you from the traditional, ancestral, and unceded territory of the Coast Salish peoples, the Musqueam, Squamish, and Tsleil-Waututh First Nations, also known as Vancouver. I host a podcast for TELUS. It's called TELUS Talks with Tamara Taggart. Hopefully you've had a chance to listen to it. If you haven't, you can find it anywhere you listen to your favorite podcasts. We just released episode 131, and it's with Dr. Shafali, and it's a favorite episode, so it's pretty good. I am your moderator for today's webinar, where we will take a deep dive into TELUS Health's recent white paper, an in-depth look at the virtual healthcare landscape. So joining us today are our guest speakers. We have Rowie Ben Ellie, who is the Director of Strategic Programs, Virtual Care, TELUS Health. Rowie is a nurse in the province of Quebec who has been practicing for over 20 years in various areas of the profession. He started on the front lines working in internal medicine and emergency departments, and then managed operations in community and private clinical spaces, where he moved into program development in family medicine, specialty medicine, and psychiatry. Rowie has worked in telemedicine services for the past 5 years, and primarily as a mental health specialist, developing programs that provide services to employees and their families. Today, as Director of Strategic Programs at TELUS Health Virtual Care, he focuses on collaboration and development of integrated and holistic care models within the broad TELUS Health ecosystem. And also joining us is Camille Lalonde, the Director of Clinical Operations, Virtual Care, TELUS Health, and Primary Care Nurse Practitioner. Camille is a dual licensed primary care nurse practitioner in Ontario and Quebec, who joined TELUS Health Virtual Care in 2017 and is now the Director of Clinical Operations. She's originally from Northern Ontario and completed her Bachelor's of Nursing Science at Laurentian University and worked for a decade as a charge nurse in a Toronto emergency department before completing her Master of Nursing, nurse practitioner, at Athabasca University. Throughout her career, she has worked in family medicine, pediatrics, rheumatology, complex chronic medicine care, and geriatrics. At TELUS Health, she is responsible for overseeing, planning, leading, and managing day-to-day virtual care operations for 70 TELUS team members and over 900 registered healthcare providers to enable TELUS Health Virtual Care to connect to more than 2 million people in Canada to primary care, EFAP, and disability management service providers. That's Rowie and Camille, big resumes, and we're ready to dive into our virtual care chat. You know, this is the TELUS Health's third industry report on virtual healthcare in Canada, following reports in 2019 and 2020. So Camille, Rowie, let's start with you. You know, what's changed and what has stayed the same over this period?
Not much has stayed the same. I mean, I think ultimately, especially with the pandemic, so much has changed. I mean, from, all of our lives being completely, kind of thrown into the fray and routine being completely taken apart, and having our kids at home and changing our workplaces, not knowing what tomorrow holds, not knowing what restrictions are coming or going, is really not a normal state of affair for most people. And I think that what we've seen is we want to find something that stayed the same. The need for healthcare got more and more prominent, but it's the same, is that we need good care, we need access to care, we need availability of well-rounded and clinicians and people that are available to help us and help the population on a day-to-day basis in our general physical care, mental health care, and other needs that we have for us and our families. That hasn't changed. What changes the acceleration of access to telemedicine, and the adoption happened during the pandemic. So that was really, kind of the pressure cooker that created that need. But ultimately, we really see how across Canada that's something that there's isolation and there was stress and a lot of fear around, the changes And ultimately that drove people to need more and demonstrate more. And that ultimately kind of showed some cracks in our system. And I don't mean just our public system, our healthcare system beyond just the public sector. It's all around. It challenged us across the board, and telemedicine was a good part of the solution at the time during a crisis situation. And now we're trying to see what does that look like beyond that. So that's really, I would say, similarities, but definitely change was the big one.
And Camille, what are your thoughts on that?
Yeah, I mean, I echo Roe's perspective, and we've both experienced this together. The pandemic forced many medical professionals to close their brick and mortar clinics, and those that were able to keep their clinics open were forced to have increased infection control protocols and reduced appointment availability for patients. So the pandemic really forced Canadians to find another way to get the care that they so desperately needed in many circumstances, given infection rates across the country. So I think what the magnitude of the pandemic really did was to expose those cracks that exist in our current healthcare system, and virtual care was a solution that inserted itself organically and provided that access where it no longer existed in the physical state.
Yeah, it seems so obvious that this is the way we should be going for a lot of things, and the pandemic really did open that up. But because of the pandemic, 60% of all healthcare appointments went virtual by April of 2020. And, was this, Camille, I'll ask you this question. Was it a matter of time before we had this, this big shift, and is virtual care, the next logical phase in healthcare?
It's interesting because when you say at the beginning of your question, you said it should be obvious. And
Yeah.
it really wasn't. I mean, so few clinicians had integrated virtual care as part of their practice prior to the pandemic. But the pandemic forced their hand to a certain point. They no longer were able to physically assess their patients in a number of cases. And so it provided this opportunity to grow and to see care delivery in a different modality. I think the other thing is, I think the shift also happened at the beginning of the pandemic. There was a certain us versus them, virtual care versus in-person care. And what we saw over the course of the last year is that virtual care is not meant to replace that existing therapeutic relationship that is so important between a primary provider and his patient, but really is there to alleviate the burden on a very overwhelmed healthcare system, on an overwhelmed walk-in clinic, emergency department. It's really a solution that can, if used properly, decant these overcrowded spaces. And the last thing I'll say is that I think from the patient's perspective, it's opened their eyes to what they can access virtually, and the simplicity of its use and the benefits to them and their entire family.
The thing that sticks out for me is thinking back to all the times I've had to go to the doctor just to get a prescription refilled, like just to get that piece of paper, or, it just might be, my child has a rash, is this a bad thing, or is this and I didn't realize what you could do virtually, right? And I do that now, and it saved me time, my family time, and I don't take up space in the doctor's office that's unnecessary, I guess, right? Is that basically what you were trying to say? What I'm experiencing?
That's exactly it. I mean, to go back to time is that one resource you can't make more of.
Mm,
So why use your time inefficiently to get to that appointment, to sit in a crowded waiting room and exposing yourself or your child to pathogens, when it can very well be done virtually and in a very safe manner.
mm.
So I love to hear that you've experienced the benefits of virtual care yourself. That's great.
Yeah. I mean, I'm not going to have a mammogram virtually, that's for sure, but at least I know I can get a rash looked at or something virtually. So that's always a good thing. So, Roe, what kind of trends are we seeing in how people are using virtual care as a service?
I think it's a great question. I think the more and more we see trends is people have gotten comfortable and seen the benefit, and they kind of start to wonder, well, who else can I see? What other services can I get virtually that can, follow this same type of pattern? And where it's obviously mental health is something that from the beginning of virtual medicine and telemedicine was already there. So that one we're seeing what more can I do? But the occupational therapy, physiotherapy, people kind of get, how does a physiotherapist do it? And that's definitely possible. And then there's other areas that we can continue to kind of augment, nutritionists and health coaching. And it really just keeps on growing, the potential to see different specialists as well on the platform. And when people challenge that, I always find it interesting. They'll tell me, well, how can an orthopedist see me, virtually? I said, well, orthopedists look at, imaging reports, and they rarely touch you. And, an endocrinologist will rarely touch you. They might want to see your thyroid, but they'll look at your blood results and imaging. So there's a lot of interactions that can occur in this manner without direct contact. I'm not saying it's never needed, but at least when it isn't, you're interacting in this manner and you're moving your journey or your path to wellness forward, right? And that's really the benefit of virtual medicine. It may not be every interaction, but every single one that you can get that brings you closer to that next step, is optimized. So I think that's really the point. And with 96, percent of Canadians have either showed that they were satisfied with that interaction, they're demanding then for what's the next thing that I can do this way.
Mm-hmm, mm-hmm. So Camille, why is access to virtual care more important than ever now? Both from, I guess, a healthcare perspective, but also, for people in Canada and also for employees specifically, right? How does this help an employee?
Yeah, it goes back to what we spoke about just on the last question. I mean, ultimately, we need to be considering the lack of access to primary care that is affecting over 6 million Canadians from coast to coast, and thinking about the importance of reserving those very precious in-person appointments for patients who truly need them, who need a physical exam, because so much can be resolved virtually. We're talking about a resolution rate of between 80 and 85%. So think of the amount of stress we could relieve from this overburdened healthcare system. And the other thing is the patients are happy, the patients are satisfied, they're getting that long-term therapeutic relationship with that same provider that they can see on a long-term approach. And as Rowie said, bring in that health prevention and the health promotion and try to take an upstream approach to care. And to answer the last part of your question, what does that do for the employers who are providing this service? I think a healthy and happy and respected employee who was given access to healthcare that they may not have had without this employee relationship is a grateful, is a productive employee. So ultimately, we are seeing some significant benefits to both the employee and the employer. And I guess the third is really the healthcare system in general is seeing the impacts of virtual care delivery.
Mm-hmm. I think that one thing that sticks out for me as, excuse me, as an employee is that, if I had to go to the doctor, we're talking about a few hours of my day at work to go to a doctor's appointment. And then I remember, where I used to work, it used to be, oh, you got to do your appointments like outside of work. Like you can't, like nobody can, right? And that's hard to do if you're recovering from major surgery or cancer, or you just need to have a check-in with somebody. So I guess it really does, like if I can pop into a private office and do a 10-minute virtual, check-in with my doctor for my blood results, that's saving my boss, me not, right?
Absolutely. I mean, 70% of consultations are happening during working hours.
I know.
It's humongous, the reduction in absenteeism.
Yeah. Yeah. Okay. So Camille, just to continue on what you were saying. So, for those of us that don't know, what kind of services can we receive virtually?
It's a question we get often from patients themselves, actually. What can I do with virtual care? And the short answer is any consultation that does not ultimately require a physical exam to make the diagnosis, to have a therapeutic benefit, and with the small proportion of consultations that need a controlled substance to be prescribed. So those are the cases in which you need a physical exam. You need that in-person assessment. But everything else, when clinically appropriate, can be resolved virtually. And the most frequent things that we see on the platform are, you mentioned earlier, dermatology, so skin issues, tons of mental health, a lot of infectious disease. We're seeing a lot of allergy symptoms, pediatric fevers, urinary symptoms, gastro symptoms. Just recently, with the opening of traveling, we over the summer we saw a lot of patients consulting prior to their holidays, and we were able to provide them with the right support so that their holiday, the first holiday in a number of years, was not ruined by a bug.
Exactly. So, Roe, we're talking about primary care, right? And we think about that a lot when it comes to these types of services. But what about mental health support? Because I think that is pretty obvious. Like, we've been many provinces are having a mental health crisis. This country, I think, there's a lot of people that don't even know that their mental health is suffering because we don't know what to look for. We don't have access to healthcare, whatever it might be, right? So what are some mental health supports that can be accessed through this TELUS Health virtual care?
I think there's definitely one of the things that we know we're trying to resolve is that there's no one size fits all, especially in mental health. There's no perfect solution that's good for everybody. Different ages, different groups, different demographics, different categories of people and preferences. So one of the benefits is that we're definitely not a one-trick pony. We have we do have our Life Journey program, which is an EAP services, so that allows for mental health to be given to employees whenever they need, and they have a certain amount of services available to them, and there's no out-of-pocket expense. I think a lot of it is also removing obstacles to care. With stigma being such a big issue, we really want to make it easy. So one of the benefits is that we have through one front door. So when you come in through one application, you have access to multiple services. With this, you have like direct therapy, face-to-face on a video interaction. We have our ICBT solution, which is really a digital approach. It's asynchronous. You're not live with the clinician, but it's clinician supervised. So it's not self-help. It's just guided asynchronously, so not at the same time. And the patient or employee gets skills and how to manage and improve their capacity and their ability to get through difficult times, also prevent future events, that are related to anxiety and depression and trauma and other substance use and sleep disorders. So there's really a lot of areas where we can really facilitate treatment for different groups, including adolescents and adults and so forth. And then you do have ultimately more and more services available to people in the preventative space, or well-being resources, so somebody can access not just when they're really not doing well, but when they're starting, or just to learn skills. And we have content and the health risk assessment and the ability to be flagged on areas that you may want to address, or maybe most of us know, I need to sleep more, I need to exercise more. No, like most of us are aware, but then how do I get started? And it's always nice when you have validated content from a provider that all in one place that can help guide you to the next steps and say, you're right, you do need to exercise more, you're sedentary way too much, this is what we can offer you, and really drive the proactive preventative approach, because ultimately we need that push, and our platforms allow for that as well. So you're not just getting your employees to visit once a year when they're not feeling well, but to interact more often and often intervene sooner. So even if they do get symptoms and they don't get well, we're acting quicker, because most people, when it's hard, they push it, right? They wait and they wait and they wait, and then they're sicker, which means they're off for longer. And during the time they're waiting, they're not performing. So you don't have a 100% performing employee. You have one that's sitting in the chair, but maybe being productive at 60% or less. So this also helps drive that to a different level. So that's really what we're able to do today. And there's so much more that's coming in mental health and other areas. Yeah.
Yeah, I mean, you said preventative, right? Like I think we always talk about that. Like we need to be preventative and take care of ourselves and do that, which is easy to say, harder to do. in the, the busy, stressful world we live in, taking care of things at home and taking care of things at work. And it's hard to be preventative because who has the time to go be preventative if you have to go somewhere, right? It's very hard to do, but yeah, it's so much easier if you can just I mean, I use virtual care for mental health too. So it's like I'm the poster child for first virtual health. It really is helpful. I will say that. So Camille, besides myself, who is the typical user of virtual care?
So what we found by looking at the results of white paper was that that typical user is a young working female with or without children who actually, in many cases, has access to a primary provider, but has access to virtual care as part of their employee benefits. And we're seeing that that individual is seeking mental health consultations through our EAP, getting consultations for herself for reproductive health reasons, for infections, for the care of her children who perhaps picked up an infection at school or has been suffering with seasonal allergies. So that is kind of the typical textbook patient. But that being said, I think what we were pleased to see, and certainly what, as a frontline clinician, I've experienced, is the increased consultation rates that we're seeing in those between the ages of 45 and 65, and those 65 and above. So what we've noticed is they have that initial consultation, and they realize very quickly, wow, that was so easy. My prescription's been sent to the pharmacy, kind of like your experience, Tamara. Like, was that really all it took? And I can tell you as a provider, it certainly feels good to be a part of that system and that solution that's bridging the gap. But what it does for the patient is they come back. They come back for a second, a third, and a fourth visit, and they realize that technology is not a barrier. It's easy to use, and they certainly use it.
Yeah, no, it's great. And you did mention that the white paper found that 96% of people who have tried virtual care or tried the app were satisfied with their experience. So, I mean, that's a huge number, obviously. It's a very good number. So, what do you think that means? Like what were they satisfied with? What we're talking about, just how easy it was?
I think, the easy access is one thing. The technology is user friendly and is safe, and is accessible. But the accessibility is a huge driving force between or to raising that satisfaction rate. Ultimately, the patient is in charge, and that's something that I think our traditional healthcare system has sometimes not done so well. The patient is often the one who is told, what day they can see a provider 6 months from now, at what time. And with TELUS Health Virtual Care, they are the master of their own health destiny. They can choose to consult at 4 in the morning if that's what time they feel they need the support. And with our approach, we really do try to create that long-term supportive therapeutic relationship. So when I see a patient for a mental health condition at 4 in the morning, I'm setting up that reassessment and I'm checking in between to make sure that they're doing, the work, the assignment, that they are eating, they're drinking, they're sleeping enough. Those frequent touch points and that focus on whole well-being and wellness, and not being constricted by that one problem visit that you get for 5 minutes at your healthcare provider's office. They're really allowed to take the time that they need to ask questions. They're supported with, patient handouts, and if they have other questions, it's just a push of the button, and there's a nurse there to answer your question.
Yeah, it's amazing. Okay, so Roe, the majority of Canadians, I guess we kind of now expect this, right? Because as a permanent option, really, because we had it, and those of us that have used it have been like, oh, this is great. Now I want to, we talked about this earlier, using it to, augment the maybe other care that we're receiving, or maybe we're not. Maybe this is the only care we're receiving right now because we know so many people don't have access to a family doctor. So, who is providing virtual care as a service, Rowie, and how can people actually access the virtual care so they can benefit from it?
It's a great question, and it's often, where we kind of get confused. Where do we actually get these services? So in our case, we TELUS Health Virtual Care offers it to employers. It's basically a benefit that employers provide to their employees, and that falls, and a lot of people are employees. Not everybody has access to it, but that's primarily where we've really seen, where it was initially used the most because it was provided. Since the beginning of the pandemic, we've seen telemedicine offered, in the provinces by government in different ways, in different modalities, in different success levels. We've also seen it offered within a EMR, so an electronic medical record. Some doctors have begun to offer it to their patient population, so their groups, the patients that they follow, not just anybody that can come in, and just say, I'd like to see you, please. And one of the benefits is also through TELUS Health Virtual Care, we offer it to employees, but employees and their families. Like there's no separating the two, right? Giving it to an employee, I mean, most people are healthy relatively well and don't access it more than once or twice a year. But when you add in, you have 2 children, you have a spouse, you have a partner, that becomes a little more often, and those all affect our ability to function. Like my kids can't go on their own; I got to take them, which means I'm going to take time off in order to do that. Mm-hmm. So we see that being offered, and people wonder where you get it from. There's also some organizations that offer it as part of their offering, like Blue Cross can offer it through the insurer will offer it as a benefit. So there's different areas, but the majority is really offered by the employer, and it's something employers are looking to offer because of the benefits of it when it comes to productivity and absenteeism and presenteeism, which are really making sure that their employees are happy, and Camille said it so eloquently before, respected, and therefore will give not necessarily more, but will give as much as they can, and they will deliver better productivity ultimately because of it. So we're really seeing it as being a big area, is really employers doing it, and we'll see where the rest follows.
Mm-hmm, mm-hmm. Okay, this next topic question is for both of you. So Camille, I'll start with you, and then Rowie, you can fill in where Camille maybe doesn't fill in. So this is, because listen, people are concerned about security and privacy, right? Those are 2 things they're very concerned about. But, cost actually was, the top factor in influencing whether someone will access virtual care, right? So Camille, how can TELUS Health help address and lower that barrier?
So I think when the cost is not in the hands of the patient and is a solution that is sold to the employer in order to attract, retain, and create a healthier, happier workforce, that barrier ultimately is eliminated. So the challenge becomes encouraging these employees to utilize a service that they may not know the scope of. They may not know how to access it. They may be scared by the technology. But when you remove that initial barrier and it is ultimately a service that is free of use and you can use it as often as you wish, this is where we're seeing the biggest benefit. For companies today, it's essentially a must. I mean, 67% of millennials say that the presence of virtual care as part of their employee insurance program is the reason that they would choose to work for that company. And as we know, our workforce is getting older. We need to attract and retain this young, healthy workforce. And so, looking at the global and the long-term effects of providing this service is really the way that we should be attacking this question.
Mm-hmm, mm-hmm. Rowie, do you have anything to add to that?
I think that often when employers ask on the cost, and again, it's affordable. That's not something that we can say that it isn't affordable. It's definitely affordable. However, you need to ask yourself the question, what is the cost of not having virtual care and these type of services accessible to your employees? And because you want them to look at it beyond the immediate cost, it costs this much per month or this much per year per employee. You look at, the other factors of, we talked about it again, absenteeism and presenteeism and productivity. There's a number there that this becomes a no-brainer. When you look at Camille even said, when you look at utilization, and that's something that you need to factor over a few years. So it's not I buy it today and I benefit tomorrow. I mean, you do, but it's harder to quantify. I think it's something, if you look over 2-3 years, you start to really see the numbers there. And just, some of the experts have looked at this, and telemedicine has been around for a while, same as the AP services. So when you look at numbers, we know that presenteeism goes up by about 20 to 25%, even higher in some cases. And when you look at that, and then the number is that when you have a present employee, that means they're there, they're focused, they're productive, and they're not thinking about they're not feeling well, or their spouse is not feeling well, their children need to get an appointment. When you consider that, there's a return on investment of about 20 to 1. So for every dollar invested, you get $20 back. That is not my number. That is the number that's been seen in studies, So it's something that when you look at the total factors in the total package, you can't afford to not have these type of services built into your package today. It just becomes, like Camille said, it becomes a must.
Totally makes sense. So, Camille, according to the white paper, employer promotion of virtual care would encourage 15% of Canadians to use it. So, I mean, I think I know the answer to this, but what would the effects of that be? Not only for the healthcare system, but the population's health in general, really.
Yeah, it definitely, I'm going to echo, some of my points from earlier. I think providing this access and providing not just episodic, acute illness treatment and acute mental health support, but really that long-term therapeutic relationship that is so important. When you have that trust with your healthcare professional and you have those frequent touch points and engagement, this is when you start to see changes in your habits. You start to make those positive lifestyle changes that ultimately have preventative effects on chronic disease development and have long-term mental health benefits. So in addition to decanting, the overcrowded system and only using physical appointments when absolutely necessary, it also has such a global effect on creating a healthy and well-supported workforce that can in turn support so many others. It really does become this ripple effect. I think we sometimes forget about the other piece to the medical journey, which is that referral to specialists. Something that we've noticed is, of those who have access to primary care, seeing your doctor promptly to have that referral to the specialist that you need is not always feasible. We're talking weeks or months before you can see them. And so sometimes just having that access to that one door in, you can see a provider, you can be assessed and referred to that specialist that you may not have been able to access if you didn't have virtual care. So treating, acute, episodic, long-term disease prevention, but then also leveraging our resources that are available to us in the public sector.
Yeah, totally. Okay, so Rowie, for employers, so when it comes to offering benefits like virtual care that differentiate from the competition, what could it mean for their bottom line?
So I mentioned it kind of before a little bit when it comes to, that calculation. And often we see that, the needs of the HR department and people working in that area to give service to their employees and the financial CFO type of conversation, they butt heads sometimes because, one's bottom line, the other one is retention, recruitment. And those, as we know, are huge challenges today in the ability to deliver on the service. Employees being at the core of obviously the delivery of every service in every industry and every organization. That talent driven market in this space really demands, and Camille mentioned it before, employees are demanding this be part of their package. They want to see it. It's part of their conversations. It's part of the interview process. It's how they select even to go to an interview today. And it has to be beyond just, simple virtual care access to it. They're looking for more. They're looking for their time means something to them. And they're also being very selective and have the ability to do so today. And within that context, the differentiation becomes really like, how good is your package? What does it involve? What does it cover? who can I extend it to? Is it just if I'm married, or is it somebody that lives with me? Because it's not open to everybody necessarily. How inclusive is it? How diverse is the offering? I think a lot of people are looking for that as well, diversity and inclusion, which is at the core of a lot of TELUS's offerings, at the core of TELUS's organization. So that becomes more and more the conversation that we're seeing being had, and the questions we're being asked when people are asking us, what do you guys offer? What does it look like?
And really, I think we've already covered, because we were talking about absenteeism and productivity, but what really are we talking about when it comes to virtual care effects and absenteeism and productivity? Like the two, they are connected.
Absolutely. And absenteeism, people ask us often, what really happens? And we see that, absenteeism is being reduced by 40 to 60%. So I just, imagine your company with 100 employees, the effect of your employees, being present 40% more, right, than they would have been otherwise. That number is an easy one to calculate. You don't need a complicated math degree to do it. And ultimately the amount of time that's saved, about 2 hours on average per visit, times what, how many employees you have, 2 hours per visit. They typically will see their doctor 2 to 3 times a year. Again, easy to do the math. I think ultimately it's also the flexibility that it offers employees, because yes, it's like, you're saying some employers demand you don't see your health practitioner during business hours. Well, that depends what your working arrangement. It also depends on your family situation. So there's so many dynamics. And these also affect employees, even if they're able to pull it off, just in the organization of it and the time that it takes, right? If you're planning your visit, you're still doing it during the day because you can't call your doctor's office at night. So there's all these things that come into play. Plus, I think the important thing is to look at the resolution that virtual care brings. There's 80% resolution rates. What does it mean? It means that most people leave with what they were coming for, the solution. 80% leave with that solution. That makes a huge, huge difference. And most people are looking for consultations during work hours. So if you're an employer that puts that type of stipulation, it has to be outside of work hours, you may not be selected as the employer of choice. And then an employer that does allow employees to do it during the day, since 70% of those happen during the day in general, at least with virtual care, it takes up 15 minutes and they're still working and productive, versus it taking up 3 hours or 2 hours like we discussed. And that's without travel time. Let's not forget that if Canada is a big, vast country, and people are traveling sometimes an hour to 2 hours in traffic to get to their appointment, I mean, the day's gone, right? So you add that in to what it costs an employee. And if they do have to take a day off to go to the doctor, they're not really happy about it. And again, they'll pick the employer that allows them to use their days the way they want to and not to go to a doctor's office. So all that comes into play. And all of that, again, is that whole conversation we had about how do you retain and recruit talent and keep them there and happy.
I think the worst case scenario, though, really is, and you talked about, we've all three of us have talked about, having to take a vacation day to go see the doctor or whatever, depending on. But the flip side of that, which I think is the worst case scenario, is the employee doesn't go to the doctor, and I've, working for 22 years, for a big company, not TELUS, a different company. That happened a lot. Like, it was like, I don't want to take a vacation day. I only get like a couple of weeks a year, so I'm not even going to go to the doctor. And then we know where that leads, right? Like, it can lead to whether it's, a week of having a migraine, or whether it's something worse, right? Like, it was something that is. So I think that, everything you said there really made me think about all the people that just don't even bother going to the doctor because they don't want the hassle of having to deal with taking time off or whatever it might be. So, Camille, I'll come back to you, because let's talk about, mental health support. We talked about primary care. We talked about mental health support. So now let's spin it to preventative health and wellness, right? I think this is super important. And, I think it means a lot to employers, like employees for sure. Like, we all need to be preventative, right? But how does that work for employers?
So I think what our service offers, what TELUS Health Virtual Care will present, is a one door in and somebody who is there to greet you, a human, a healthcare professional who's there to greet you and to really talk through not what is wrong, not what is the matter with you, but what matters to you. And so sometimes we take a very pragmatic approach to medicine and we really focus on the problem that is right in front of our eyes without looking at the whole person and the whole context in which that person is existing. And so when we talk about wellness, we really talk about treating the person as a human being, and a human being that is being affected by a lot of social determinants. You know, are they currently experiencing marital problems that are ultimately leading to a flare of their intestinal disease? But at the source of the problem, if you don't fix, you know, those marital relationships, you're not going to fix the acute symptoms. And so we try to really give space for exploring that with patients. And we have the benefit of having a look into their world. When we're taking consultations from their home, we can get supplemental information from present family members. We can see, you know, are they in a lit environment or are they sitting in darkness and really withdrawn? I can ask them to show me what's inside of their fridge to make sure that they're actually eating and drinking in the context of depression. I can see my patient with generalized anxiety disorder who's sitting on his couch with his dog on his lap, who traditionally would have taken him great effort to get out of the house and get that mental health support. So I think we've just chosen to take a different approach to wellness and whole health. And the other thing I'll add is that we provide a lot of great allied health support. Sometimes we forget about the importance of speaking to a nutritionist when you have a new diagnosis of diabetes, of hypertension, you know, speaking to a legal counselor or financial advisor. I mean, these are all accessible from the palm of your hand if you're using your cell phone. And ultimately, all of those professionals will have such a deep impact on the outcomes of that individual and their loved ones.
Yeah, absolutely. So, Roe, you know, we know that virtual care has the interest in it has increased, right, since 2019. I think in 2019, 71% expressed interest in receiving it, but only 9% of employers offered it. So, I guess my first question to you, Roe, is how have those figures changed? And then are we seeing that gap close?
We're going to see that gap close. I mean, I think it's still in context. I think that during the pandemic, because we talked a little about it, governments were deploying some solutions. So employers are kind of waiting. It's like, maybe I don't have to flip the bill for this, which is fair. But those solutions also have different access points, different times, and not maybe part of an integrated strategy. And I think a lot of times we tell employers, you know, you have to look at it in a bigger overarching strategy of your wellness packages and platform for your employees. We know that also 80% of employees said, I would rather have a better benefits package, including virtual care and other types of services like this versus a pay increase, right? One's a taxable benefit. This one is a little different. One is, you know, benefits your quality of life. And they're starting to make those type of comparisons. And employees are just not, money is not king. It is still a very big factor, absolutely, but there's other pieces that come to play, and it's something to keep in mind. So we're going to see a growth in that area. I think also, you know, as the, you know, the solutions come together, they're looking for simplicity. I think employers were some that were hesitating that had, you know, an EAP offering and they wanted virtual care, but it didn't plug into each other. It wasn't as dynamic. It wasn't as seamless. Are starting to look for, how do we make it easy for my employees? You know, they hit one spot, one door in, they go there, everything is available to them. That's a much simpler approach. And that allows them to consider it as a different type of benefit that's not as complex. Before, they had to manage multiple suppliers, providers, multiple applications, and today they're looking for an integrated solution. So as it gets easier to use and more affordable, the prices have changed over the last, you know, 5-6 years. So it's more affordable, more dynamic, more integrated. employers are like really starting to look at it differently. So we'll see a push up. We know that for sure. It's going to be interesting to see, how deep it goes. But I mean, predictability wise, we're expecting most employers to offer something like this going forward. It's very hard to imagine a world where an employer doesn't provide it or give access to it in some shape or form. It's just part of the package today.
Listening to you, say all of that, I agree with you. And we were, obviously I agree with you, Rowie. But we were talking about mental health a lot, right? And we know that people are still very private about their mental health. And do I want my employer to know that I'm talking to somebody? Do I want my employer to know? So, and I'll open it up to either one of you about this. If I'm an employee and I'm seeing somebody about my mental health, will my employer know? Like, is it like, how private is this? That's a big concern, right, for a lot of people.
It is. It's a concern that we hear a lot, and it's a misconception about a telecommunications company being partnered with a healthcare delivery system. The short answer is absolutely not. We take privacy and personal health information and data safety so seriously. While we promote and encourage everyone involved in the circle of care of a patient to have a team-based approach, and that does take the sharing of information, it is always up to the patient to decide what gets shared, how it gets shared, who gets to be part of this circle of care. And so our release of records is deeply embedded in a very informed consent process. And we really do hear this question come up quite often, because in the context of an employee assistance program or a mental health consultation, a lot of delicate situations can be discussed, and whether we like it or not, there is still a stigma around mental health, especially in the workplace. And I can just imagine how scary it might be to think that your direct supervisor or your company is aware of what's discussed. So we take great pride in ensuring that our release of records is always consent driven. Our data and our privacy are of the highest importance in what we do.
Anything you want to add to that, Rowie?
Camille said it so well, as it being the driving force of every interaction. But I think we have to remember that we're in the same boat as employees, as parents, as spouses, children. We all want that information safe, but at the same time, we all expect it. It's a given that it be communicated appropriately between caring clinicians. I want my doctor to have access to my blood results and my imaging. I want, my psychologist to be able to reach out to my doctor and be like, this is what I saw. The medication is not working. Something is got to give. So I think there's expectation for a specialist and a doctor to have that information available to be efficient. And I think that technology allows that efficiency that before was difficult. I mean, we used to have to mail, clinical specialty consultations over to the doctor, and then they have to open it and then they have to read it. And today it comes right in, and that allows for an interaction, one, to be more dynamic, more efficient, but it also allows care to happen faster. And all of us want to see that happen. We just want to make sure that we're doing it right. So some people say, why is it taking so long, that I can't get access to this quickly? It's because we're trying to put the right steps in. Previously, things were very siloed for good reason. Today, we're trying to bridge those silos, but that information exchange, like Camille was saying, has to happen with consent, securely and privately, and also give the power back to the patient to decide who is included in that conversation. And that's what keeps us, it's what keeps us up at night. It's what we want to think about every step of the way whenever we're trying to create it, but it's a necessary expectation to allow interoperability and conversations and discussions and exchange of data to occur seamlessly and efficiently. So when you sit in front of your doctor, it's not like, no, we didn't get them yet, but that's the point of my appointment today. I was here for this. It's like, yeah, sorry, didn't come in. We'll have to see you again in 3 weeks. You're like, so that's really can't continue to happen. And I think that, we work very hard on it, but it has to be private, it has to be secure, and it's part of, our day-to-day thought process whenever we're building that, what we call longitudinal conversation and longitudinal care.
Mm-hmm. Okay, we have a question from the audience. So let me just, okay, so yeah, so obviously there'll be another industry report. There'll be lots probably on what happens with virtual care. So for either one of you, what do you foresee as what's next, or what should we be expecting in that next report? Any predictions?
We've touched on a few things that I think will certainly continue to be at the forefront of the discussion. I think one thing that we may start to see sooner than later is the aging workforce, but the aging medical professional workforce. So as our healthcare providers are aging along with the workforce, we're really needing to put in some serious thought as to how we attract and retain the clinicians that need to be delivering this care. And so I think that it certainly is going to have an impact on global health. I'm very curious to see how it'll impact virtual care. And along with the important points that Rowie so well described, so privacy and data, integration of systems. It would be so lovely to be in a world where the public healthcare systems would just feed beautifully into and integrated into all virtual care platform deliveries. So I think that's where I'm most curious to see where we go next.
Rowie, what do you think?
I think that, the most interesting thing, and we mentioned AI and machine learning and all these things, and I think there's a lot of fear around, the replacement of clinicians by, algorithms and these type of approaches. I think ultimately there's so much to gain from having a doctor be supported in augmented services with these type of technologies. The ability to have up-to-date information available to our clinicians so they can actually give us the best care possible. Is something that we're going to see integrated more and more into these type of solutions, and in a safe manner, right? Ultimately, the reality is we have like Camille says, an aging clinical workforce. I think there's also not just aging, but there's a disenchanted workforce after the pandemic where they felt really, burnout is prominent in that space. And if you're going to have clinicians continue to care for people, well, you're going to have to give them the right tools to do it and to do it well without them burdening their own life. They give enough. There's not much left to give in a system that needs to be able to be scalable. You need to be able to give people services when they need it, how they need it at the right time, and get the right treatment possible. And that doesn't happen with some sort of digital augmenting and support. And I think we're going to see a lot of different types of people and clinicians on platforms like virtual care to contribute. It doesn't make sense to come in, I hurt my shoulder to wait to see a primary care physician when you can see a physiotherapist that can help you through it. And ultimately, because medication isn't the answer for everything. It's one of the solutions, but it's not the only one. So I think we're going to start to see that. And we're seeing already governments, in Quebec and other governments starting to see how do we use these professionals at the right moment, at the right time, instead of just putting everything on the doctor or the nurse practitioner. It's not realistic. It's not scalable. We can't make them fast enough. And it's not the best way to approach care. So I think that's where we're going to see this in the near future. I'm not talking like 10 years. I'm talking the next 3 to 5 years. We already see pharmacists being able to renew prescriptions and physiotherapists being able to refer to imaging. That makes sense. It makes sense to use the people at the right moment. And I think we've kind of sat on our hands a little bit over the last 50 years and just let the doctors take the brunt of it and let the other clinicians sit back and wait, when now we're going to see kind of an evening out for the benefit of everybody.
You know why it's taken so long, Rowie? Because change is hard. Change is very hard for everyone, really. It's hard to change a healthcare system. It's hard to change an educational system. Change is hard. We get, as human beings, I think we just get set in our ways, and it's like, this is the way it's always been. But, the modernization of healthcare and wellness is, it benefits everybody, really. And I can't thank both of you enough for for all of your, your information and this chat. And thank you to the questions that came in. It's really helpful. The both of you have really helped us see this in from a healthcare point of view, right? And how this can be helpful for all of us, employers and employees. So thank you very, very much to both of you. And thank you to everybody that joined us here for TELUS Health Virtual Care in Canada. What's next? I hope you have a great day. Thank you for joining us.